School teachers, daycare operators, and parents are being asked to be alert as several learning institutions are faced with a hand, foot, and mouth disease outbreak. Hand, foot, and mouth disease is a mild contagious viral infection common in young children 5 years and under, with symptoms such as sores, skin rash on the hand and feet, and more. Acting Chief Medical Director Taisha Donald explains.
Now, generally, like around maybe let's say twice a year or so, we would see outbreaks of hand, foot, and mouth. Generally, sometimes we see it early in the year, and we're actually having one outbreak right now. So there's actually quite a number of children diagnosed with it. It's seen in children 5 years and under, and it's highly contagious. And normally, persons will come down with hand, foot, and mouth disease within 3 to 6 days after exposure. So if you were exposed to a child who had the disease, whether it be droplets from the respiratory system, whether it's saliva or the blisters on the skin, the liquid from the blisters on the skin.
The usual period for initial infection to the time symptoms appears is 3 to 6 days. Children may get a fever and develop a sore throat. They sometimes lose their appetite and don't feel well. Dr. Donald says 1 or 2 days after the fever begins, painful sores may develop in the front of the mouth or throat. A rash on the hands and feet and sometimes on the buttocks may also appear.
Because it's a virus, what we recommend is that you do symptomatic treatment. So for the fever, you would give your fever relievers like paracetamol. Generally, that's the most common one that we use if there's a fever. Then for the rash, because it's a virus, you have to let the rash run its course. But sometimes that rash can become very itchy. And so to help soothe that, we sometimes recommend things like Benadryl cream or calamine lotion or calamine cream, which would help soothe the rash, helps to dry it up, and help to relieve some of the itching. On the rest of the body, the hands and the feet, we have to wait it out as they would dry up. And sometimes they look like little burns when they start drying, but you let it dry, then it would scab, and then the marks sometimes is what we'd have to deal with at the later date.
There's no specific treatment for hand, foot, and mouth disease. However, Dr. Donald, who is a pediatrician, notes that frequent hand washing and avoiding close contact with people who have hand, foot, and mouth disease may help lower your child's risk of infection. The doctor gave some tips on how the spread of the disease can be managed.
Just to remind parents that once you notice this is happening with your children, you must try your best to keep the children at home, because remember, it's highly contagious. So once there's any signs of hand, foot, and mouth disease, you keep your child at home until the lesions have started to dry up, and to make sure that that child is no longer contagious. In places like the daycares, the schools, and so, if one child is identified, of course, the school and the other parents must be notified so that they can be vigilant. This disease is also a reportable disease because it's fever and rash. So it's reported to the Ministry of Health. So in a case where there's one child in a school or a daycare that has hand, foot, and mouth disease, it's recommended that you close down the unit, you sanitize, you clean, and then of course you then bring back the healthy children back into the environment.
Parents are also reminded that while they keep their child at home, precautions should be taken for other children in the home who are not infected. For GBN News, I am Rena Pett Thomas reporting.